Ladies and gentlemen, boys and girls, theys and thems, esteemed colleagues and psychonauts, welcome to our video comparing MDMA versus psilocybin. In this video, I'm going to cover 5 key differences between these two front-running psychedelic compounds, as well as one bonus difference. So make sure that you stick around all the way till the end of the video. I'm Dr. Ben Malcolm, psychopharmacology consultant, psychedelic educator, and founder of the website spiritpharmacist.com. Let's dive in. Before we get started, just a quick disclaimer. This presentation is for informational, educational purposes. It is not medical advice, and I recommend that you do not break the law. And if you could just do me one more thing right now, quick favor, if you haven't yet, make sure to subscribe to this channel, follow the content so that you can get notifications each time I make a new video so you can stay abreast and on top of the latest developments in psychedelic science, research, and the pharmacology of various psychedelic compounds. Let's start with an overview or rationale of really why we'd want to compare MDMA and psilocybin in the first place. So both of these compounds really are prominent frontrunners in psychedelic-assisted therapy, and I think I come across a lot of information that tends to talk about them generically or sort of lump their activities and actions together, but they truly do have very different mechanisms, different flavors of the subjective experience, differences in some of the ways that they might interact with different types of conditions or present different types of risks for various people. And the medications that they're taking can also give rise to differences in the drug interaction potential that might kind of change our decision-making process overall. So understanding these differences is really going to be key for a person to come into whatever experiences that they are after with true informed consent and an understanding of the risks and benefits of what they're up to, but the risks and benefits of the alternative options as well. And so I think that this information really is relevant for lots of stakeholders at this moment in time. So for the end users, patients, clients, absolutely, but also for clinicians, right? Providers that are trying to help people navigate these decisions or provide high quality, objective information to the people that they're serving. The first difference that I want to highlight between these two compounds is their pharmacologic mechanism of action. And overall, both of the compounds still have a serotonergic type of mechanism, but they really do have different activities within the serotonergic nervous system. And I would say that the activity of MDMA is just a little bit less specific, and it tends to spill over into other types of neurotransmitter systems as well. And so MDMA, or methylene dioxymethamphetamine, is a serotonergic amphetamine. So it primarily releases serotonin, and that's what gets it leaning a little bit more psychedelic or entactogenic and pathogenic, right, compared to your standard types of amphetamines. But it does also release dopamine and norepinephrine, which is a mechanism of traditional types of stimulants. Beyond that, it has some ability to bind serotonin receptors directly, also has some neurohormonal types of activities. So MDMA can stimulate the release of oxytocin, a social bonding neuropeptide. It can also stimulate the release of vasopressin, or antidiuretic hormone, which could play into some of MDMA's adverse effects or toxicity mechanisms at times. And so really, when you're thinking about the mechanism of action of MDMA, probably some of the best ways to really conceive of it, again, is as a serotonergic amphetamine that leans towards prominent activity in the serotonin nervous system, but truly has an amphetamine backbone and some pharmacology related to amphetamines as well. Whereas psilocybin is a classic psychedelic tryptamine type of compound, and the classic psychedelic tryptamines are all non-specific agonists at serotonin receptors, meaning that they can directly bind with serotonin receptors, and that's how they produce their classic types of effects as far as non-ordinary hallucinogenic types of states. And psilocybin truly does bind to some other types of receptors with lower affinity, things like alpha receptors, However, this probably isn't the mainstay of its mechanism overall. So MDMA rather nonspecific, a serotonergic amphetamine, whereas psilocybin as a classic psychedelic tryptamine, nonspecific at binding serotonin receptors, specifically binding the serotonin 2A receptor, produce its classic psychedelic activity, but overall the mechanism of psilocybin is a little bit less complicated and it really doesn't have that amphetamine backbone to it. And that's important, and we'll talk about it a little bit more as we go through some of these other differences. Number two that I think really does tightly connect with the previous difference around mechanism of action is the types of subjective experiences that occur with either MDMA or psilocybin. So MDMA tends to be known as the entactogen, the empathogen, to touch within or to generate a state of empathy. It's known as ecstasy and not agony on the streets for a decent type of reason overall. So it tends to be a little bit more grounded. The person retains a sense of self with MDMA. However, the sense of self has a reduced ability to go to really fearful types of places or reactionary ego defensive types of places overall. There's a warmth to MDMA and an ability and desire to connect with yourself and connect with others on a deeper type of level overall. And so if you really start thinking about the therapeutic focus of MDMA, which I'll go into on the next slide, it really kind of connects with its mechanism of action and the subjective experience. Whereas psilocybin, again, is a very profoundly world-altering type of experience where there are large changes to the way that the world is perceived, the way the brain processes, particularly visual and auditory types of information, but internal information from viscera, organs, seeing old problems in new lights. Right. And so psilocybin inherently has a much more introspective shift in perception type of flavor to the experience. And some of the more specific words beyond psychedelic are things like entheogen, meaning to cultivate the divine or cultivate God from within, or hallucinogen, right, meaning to generate hallucinogenic type of activity. Right. And so these subjective differences, again, really tie back to those mechanisms of action. And they also really tightly tie into the therapeutic focus, which is a third difference that I want to cover in this video. So when we think about MDMA and its breakthrough designation, right, it's designated as a breakthrough from the FDA for treatment refractory PTSD, right? So a type of condition that is really hallmarked by fear and stress and recurrence physiologically of fearful memory states from the past. So if you sort of think about what I just said with the subjective experience, that it has this retention of a sense of self, yet a lowering of fear and ego defense mechanisms, you can see how it really might help a person walk through some of the more horrific, traumatic, difficult memories and times of their life and really be able to stay with it and stay with it with a sense of safety that allows them to emotionally process those events and really kind of put them in the past or put them behind them so they can really arrive in the present and truly live their life. And I would say that the indication around MDMA that really hasn't been explored from the angle of medical approval at this time, but is one that's really kind of been there from the beginning with MDMA, is couples therapy. And again, if we start thinking about some of the subjective activities of the MDMA as far as having this defense and reactive lowering type of property, you can also understand how persons may be able to have much more productive and problem-solving oriented types of conversations with each other, probably with some kind of expert structure or guidance to enhance the efficacy or make sure things kind of stay on the tracks overall. But you can kind of understand how that subjective effect could really lend itself to a therapeutic benefit for couples that are trying to work out some things. Whereas psilocybin has this big picture, large aperture, kind of shake the snow globe, have a person philosophically reevaluate who they think they are, how they relate to the world, how they relate to nature, how they relate to the cosmos, right, or divine or God at large. And so you can see how that mechanism really might allow the person to have a big aha moment or this kind of perspective shift of how they kind of see themselves. And I think one really classic thing that can occur with psilocybin is for a person to realize that they are not alienated in the universe and that their physical atoms really do not separate them from the trees, the rocks, nature's, other persons, the cosmos at large, and they realize that they are just a divine emanation of it all that is connected in a way. And that really helps with what I feel many persons suffer from, which is this sense of alienation. Like all of these other people, all of these other things belong here, but I really don't in some ways. And that can be a very lonely, isolating, and depressive type of feeling. And so to have that sense of spiritual connection with everything restored is probably some of the ways that the subjective activity of psilocybin can really help a person. And there really could be more, right? Like I'm talking about the therapeutic focus in the context of what the subjective effects of the substances are, but there are truly neurobiological types of changes that are linked with these types of substances, neuroplastic effects, things that raise neurotrophic types of factors, right? So it seems like they can have an unlearning and relearning or this sort of adaptive and transformative type of effect to them overall. So particularly things like psilocybin, but again, even MDMA does bind serotonin receptors to some degree. And so while this video is about the distinctions between them, there really can be a little bit of similarity and overlap between some of the aha moments or epiphanies at times as well. The fourth difference is now a little bit more logistics related as far as psychedelic assisted therapy duration and session structure. So MDMA is actually a relatively short-acting type of substance. If you take a single dose of MDMA, it will typically last strongly for at least 3 hours, but usually by about hour 4, you can notice some of the effects wearing off and essentially coming down from the substance's main intoxicating types of effects. So the way that MDMA-assisted psychotherapy sessions are oftentimes conducted is with an initial dose. The initial doses are usually 75 to 125 milligrams, followed by an offering of a booster dose that's 50% of the initial dose about 2 hours later. So for example, if a person was given 100 milligrams of MDMA to start, they would oftentimes be offered a booster of about 50 milligrams, maybe an hour and a half to 2.5 hours later. So about 2 hours later overall. And the idea of that booster is really to plateau them in an optimal space or window to conduct the type of psychotherapy that can occur with MDMA, rather than really kind of getting them in a whole nother level of intoxication. So it's really to extend the therapeutic window or the optimal sort of cognitive space to do psychological work rather than increase the level of intoxication a person has. Whereas psilocybin, you actually get a really rapid tolerance to its subjective effects. And so you can try boosting psilocybin sometimes if the initial dose feels weak and not very much is happening. But oftentimes, even a few hours later, you've already developed some level of tolerance to psilocybin. And so the boosters are very plus or minus, whether they really show up or take a person to a deeper space. And then psilocybin is just a little bit of a longer acting substance overall. So just one dose can last somewhere between 4 to 6, and sometimes with stronger mushrooms, even 6 to 8 hours overall. And so with psilocybin, it's a whole lot less traditional to offer boosters, and the clinical trial protocols that I've seen to date really haven't offered boosters so far. And so I would say that in a blanket way with psychedelic assisted therapy, whether it's MDMA or psilocybin, most of the times that the person is really in the sort of peak state of the psychedelic, it really is going to be an encouragement the person to focus inwards. And the ways that they do that is actually to kind of use blindfolds or to block out the sort of visual sensory input. We think this sort of heightens the internal landscape of what a person is feeling. And then to use music, evocative music that's devoid of linguistics, to help guide some of the emotional effects of the experience. So there really isn't very much talking or talk therapy that's occurring during the sort of prime time intoxication hours overall with either MDMA or psilocybin. And there may be an opportunity to do a little bit more talk therapy on the tail end of either of the days with these substances, but I tend to think that probably talking just feels a little bit better towards the end with things like MDMA versus psilocybin, where the person may have had something very profound, sacred, mystical happening inside. And sometimes, starting to talk about those things immediately, it can kind of almost like lower how special that moment was overall. So sometimes with psilocybin, particularly if big things happen inside, mentioning that or saying, something really big happened today, I think is a good start to the kind of integration process, but probably not really unpacking it all in the few hours after that ended, and just sort of letting that really special experience sit with the person for at least a day or two. So let's talk about safety of these two compounds now, because I really think that this is one of the bigger differences that can sometimes sway my decision making or the information that I give a person that will help them make their decisions one way or another, even when maybe some of the therapeutic indications get us leaning one way or another. So for example, when persons come and they're really hoping for help with something like PTSD, and they're asking, well, which of these substances has better data for treatment or management of PTSD? MDMA is the clear winner. They're beginning to study psilocybin for that at this point in time. There are some clinical trials that have been planned or maybe ongoing or recruiting, right? So it's not that there isn't interest in using psilocybin for that indication overall. It seems that the psychedelics are rather trans-diagnostic, or they could probably be used for various types of conditions. But, thinking through the mechanism of action and the subjective effects, it's probably fair to say that MDMA may have a therapeutic advantage as far as psychological safety for a person that is really experiencing severe symptoms of trauma stressor types of disorders, where thinking through the mechanisms of psilocybin, it sort of makes sense that we're studying it for refractory depression, conditions with a high level of rigidity to them, like OCD, where sort of loosening their worldview could provide a lot of benefit. Persons that are almost like stuck in the way that they see themselves pathologically, so body dysmorphia and other eating types of disorders, or existential crisis, depression and anxiety associated with life-threatening illness is one of the front-running indications for psilocybin-assisted therapy. So again, it's more of a break a rut, break down some rigid or organized types of structures that really are maladaptive and not serving the person well, or allow them to come to grips with some of the bigger picture questions of their life. What is the afterlife? What legacy are they leaving behind? Spiritual experiences towards the end when they have a progressive type of illness. MDMA is the designer amphetamine, and it really follows a very traditional toxicology profile associated with other types of amphetamines. So MDMA truly has an overdose limit or an overdose point. Persons overdose on MDMA, it presents as this hybrid between a serotonin syndrome or serotonin toxicity and a stimulant toxicity. Both of those can be life-threatening overall. And so MDMA at moderate doses is a relatively safe type of substance, but you start pushing things to high parts of its dosing range or just excessive types of doses overall, then you really can run into a whole lot more risk for extreme physical toxicity. And even MDMA at normal types of doses, it can be metabolized to some pro-oxidative or free radicals, so cellular damaging types of metabolites. It can deplete neurotransmitters, so it tends to have just a little bit more of a lull or refractory recovery period after it than psilocybin. And so psilocybin now is a toxicologic freak, meaning that it doesn't have a lethally defined dose in human beings. The margin of safety, at least physical safety, with psilocybin and other classic psychedelics as well, like LSD or DMT, is pretty darn impressive, and it's atypical compared to the vast majority of other types of psychoactive substances out there. So psilocybin can be very intense psychologically, and a person can definitely take too much and end up in psychological places that are overwhelming. And sometimes the aftermath of those types of experiences can be very psychologically destabilizing for persons and individuals. But physically, psilocybin has a clear safety advantage over MDMA. And so there's probably more leeway, for example, to consider higher doses of psilocybin in certain candidates where it really seems safe and or warranted, whereas MDMA we're probably going to be much more conservative when it comes to our overall dosing and approach, and probably stick very similarly to the vein of what they've done in clinical trials and truly demonstrated is clinically safe for people. So that wraps up our 5 differences that I wanted to cover. And now I want to talk about one extra difference, a bonus to this video, the interaction potential with SSRI, and I would add SNRI types of antidepressants. And so these are really commonly prescribed antidepressants that block the serotonin reuptake pump. And a lot of people with conditions like depression, anxiety, PTSD, OCD, other 3 or 4 letter acronyms in psychiatry are going to be using those types of antidepressants as first line agents. And unfortunately, they really don't produce the therapeutic benefits that a lot of persons are really hoping for or maybe even need to clinically feel better. And so some alternative options for those types of conditions seem to be MDMA or psilocybin assisted therapy, and they may even offer advantages or have superior efficacy to SSRI or SNRI types of antidepressants. But how would a person approach these, or what would a person need to do to be able to safely and effectively access things like MDMA or psilocybin assisted therapy if they were taking those antidepressants at baseline? Well, at this point in time, it really seems unfortunate for the antidepressant user that's trying to approach MDMA, because the drug interaction potential between those two classes seems to be relatively strong. Overall, there's many ways or mechanisms that SSRIs could interact with MDMA. Probably one big one is that MDMA is unable to release serotonin when you have an antidepressant blocking the serotonin reuptake pump. So the overall most consistent common effect when you mix MDMA and antidepressants is going to be a dud MDMA experience. The antidepressants have complex mechanisms where they change the serotonin nervous system and targets that are expressed within it over time. And so there is a downregulation of serotonin receptors. That's another mechanism that antidepressants could have that would affect either MDMA or psilocybin. Some of the antidepressants can also raise blood concentrations of MDMA. So at normal, usual therapeutic doses with a single antidepressant agent and the clinically studied dosing range of MDMA, the combination consistently duds. And it duds to a pretty significant and severe degree, to the point that tapering, discontinuing, washing out the antidepressant for at least 2 weeks, maybe 4 weeks or longer, is probably the closest that I could possibly say at this moment in time with the information that we have to be a evidence-based, or the closest to a rubber stamp that MDMA is going to be able to produce a strong effect and truly be safe for the individual. You know, sometimes I get questions, well, could I just take more MDMA to outcompete the effects of antidepressants? And I would say, I don't think it's a great idea, because if we start taking high doses of MDMA, we might compete the antidepressant, but we might put ourselves at risk for some type of toxicity, either through serotonergic excess or just amphetamine excess, because I'm really worried and concerned that the antidepressant is blocking the serotonergic aspects of MDMA, but it's having a whole lot less of an ability to block the amphetamine aspects of MDMA. So I'm really not a fan of just pushing the dose of MDMA up and up, higher and higher, to try to outcompete antidepressant resistance. Whereas with psilocybin, there is still a drug interaction between them because antidepressants, with their long-term neuroadaptive effects upon the brain and the serotonin nervous system, they can down-regulate serotonin receptors, and those serotonin receptors really are the target of psilocybin. So there is still an indirect type of drug interaction between psilocybin and antidepressants, but this indirect drug interaction tends to be relatively minor. So it seems that on average, when persons are taking antidepressants, maybe they expect 20 to 30% less psychedelic activity out of psilocybin with its usual types of doses. And psilocybin, again, is the type of drug that doesn't have a lethally defined limit. And in the state program that Oregon has, they're allowed to use doses of psilocybin or psilocybin analyte that are approximately double the doses that they've really studied and used in clinical trials. And it seems a very viable strategy from working with many of those Oregon psilocybin service centers that persons can remain on their antidepressants or take a minimal break, skip it for a day, and take normal or higher than normal doses of psilocybin, right? So a normal dose might be 20 to 25 milligrams of synthetic psilocybin, somewhere between 2 and 3.5 grams of dried mushrooms. But some persons will be able to take a little bit higher, maybe 3.5 to 6 grams of dried mushrooms, and really kind of outcompete their antidepressant, get the true psychedelic experience that they want, and have it all be physiologically safe for them. And so there's a whole lot more wiggle room for the antidepressant user to try and likely experience therapeutic benefits safely from psilocybin relative to MDMA. So to wrap up and conclude this video, our high notes here are that MDMA and psilocybin are both serotonergic, but they really aren't interchangeable substances overall. Each has distinct mechanisms and effects, therapeutic strengths, as well as drawbacks. Preparation and screening is relatively similar between the substances, although depending on what conditions a person has, the medications that they have, the types of conditions and struggles and symptoms they have at baseline, we really can think that one or the other might be a better place to start. And so matching persons with their individual characteristics to the characteristics of the substances as far as efficacy, safety, maybe even style of work or use is going to be the way that we truly enhance the efficacy and safety as the psychedelic renaissance continues to roll out. If you enjoyed this video, please give it a like. If you haven't subscribed to our channel yet, please go ahead and subscribe to the channel. Until next time, stay safe and be well.